Good afternoon. Today we will discuss about the anatomy of the urethra. The urethra is a tube that connects the bladder to the urinary opening for the removal of urine. Female use their urethra only for urinating, but males use their urethra for both urination and ejaculation. The urethral splinters are two muscles used to control the exit of the urine. You can see the two urethra, male urethra and female urethras. Male urethra, let's discuss about the anatomy of the male urethra. The male urethra is approximately 15 to 20 centimeters long or is around 7 to 8 inches long. In centimeters, it is 15 to 20 centimeters, and inches it is 7 to 8 inches. It opens at the end of the penis. The This is the hole at the tip of the penis that both urine and semen are released from. The male urethra anatomically divided into three parts. That one is prosthetic urethra, and membranous urethra. This is one is membranous urethra, and third part is penile urethra. Anatomically, male urethra divided into three parts: prosthetic urethra, membranous urethra, and penile urethra. Discuss about anatomy of the prosthetic urethra. Begins as a continuation of the bladder neck and passes through the prostate gland. It receives the ejaculatory ducts containing spermatozoa from the testis and seminal fluid from the seminal vesical glands and the prostatic ducts. It is the widest and most dilatable portion of the urethra. And second one is membranous urethra. It is the intermediate part of the urethra. You can see in the image. It is the intermediate part of the urethra situated between the prostatic urethra at the superior and the penile urethra in the inferior, surrounded by the external urethral splinter, which provides voluntary control over the micturition. It is the narrowest and least dilatable portion of the urethra. And third one is penile urethra. So penile urethra, you can see in the image, inferior part. Penile urethra passes through the bulb and corpus spongiosum of the penis, ending at the external urethral orifice. Receives the bulbourethral glands proximally. See, penile urethra, it passes through the bulb and corpus spongiosum. It passes through the bulb of the penis, and see, this is the bulb of the penis. It passes through the bulb of the penis and to or into the corpus spongiosum of the penis, ending at the external urethral orifice. Receives the bulbourethral glands proximally. Let's discuss about the neurovascular supply. The arterial supply of the male urethra is different arteries. First one is prostatic urethra, supplies by the inferior vesical artery, and membranous urethra supplied by the bulbourethral artery, and penile urethra supplied by the branches of internal pudendal artery. Nerve supply to the male urethra is derived from prostatic plexus, and lymphatic drainage, it drains into the internal iliac nodes. And clinical relevance, male catheterization. Urinary catheterization is the process of inserting a tube through the urethra and into the bladder. This is typically performed in the situations where urine output needs to be monitored or when the patient is unable to pass the urine. Catheterization is more complex in males. There are two angles to consider, the infrapubic and the prepubic angles. The prepubic angle can be diminished by holding the penis upwards during urinary catheterization. It is also important to know three constrictions in the male urethra: the internal urethral splinter, the external urethral splinter, and the external urethral orifice. So this is the anatomy of urethra. Urethral meatus, fossa navicularis. This one is has fossa navicularis, penile urethra, bulbar urethra, membranous urethra, prosthetic urethra, and bladder neck. Let's discuss about the anatomy of female urethra. You can see kidney, ureter, bladder, and this one is urethra. In females, the urethra is relatively short compared to the males. It is approximately 4 centimeters only. It begins at the neck of the bladder. So it begins at the neck of the bladder and passes inferiorly to the perineal membrane. Passes inferiorly through the perineal membrane and pelvic floor muscles. The urethra opens directly onto the peritoneum in the area between the labia minora meets. Neurovascular supply. The arterial supply to the female urethra is via internal pudendal arteries. And nerve supply to the erases from the pudendal nerve and lymphatic veins into the internal iliac nodes. See explanation. In females, the urethra is relatively short. It begins at the neck of the bladder. See, it begins at the neck of the bladder. It begins at the neck of the bladder and passes inferiorly through the perineal membrane. Passes inferiorly to the this here the perineal membrane is located. See, inferiorly to the perineal membrane. See, uh, it starts at the neck of the bladder and passes inferiorly through the this one is the perineal membrane, passing inferiorly to the perineal membrane and the urethra opens directly onto the perineum in between the labia minora. Opens directly into the perineum. See, directs openly into the perineum to the labia minora and majora muscles. Here is the anatomy of female urethra. A clinical relevance: urinary tract infections. Due to the short length of the urethra, women are more susceptible to infections of the urinary tract. This usually manifest as cystitis. Cystitis means inflammation of the bladder. Common symptoms of cystitis are dysuria, painful micturition or pain during urination, frequency of urination increased, and urgency and hematuria, that is blood in the urine. And a simple urinary tract infections are typically treated with 3 days course of antibiotics. So this is the image. Here is the one important image for female urinary tract and female urethra. This one is both male urethra and female urethra.